Hi, everybody. This is week 5. Hard to believe. In the chat is the link to all the previous recordings and where this week and next week will also be. Today, we're going to, let's see if it'll let me switch over. Okay, so this week, says week 4, it's supposed to be week 5, hot flashes. We have done points for fatigue. We have done points for headaches and neuropathy and nausea. Hot flashes is another thing that comes up all the time, and acupressure can be really helpful in the moment. So we'll do a few points for that. On the next slide, talking about method of acupressure. So I've said this before, but we'll review it. You want to find a space and a time that's comfortable for you. Depending on where the points are, you want to be able to get to your head, your upper back, legs, hands, arms. Typically, this is done once a day. It could be, especially nausea and hot flashes, that you're doing them when you have them, when you feel nauseous or when you have hot flashes. The pressure can be with fingers, thumbs. I'm looking for a pencil. I don't have a pencil, but in previous weeks, I've used a pencil with a nice thick eraser. You can also use that on the points as well. The point of the pressure is meant to be firm, but not painful. It might feel a little sore, but you shouldn't be pressing hard enough to leave any sort of bruising, right? And then as the last point, treatments are done every day, once per day, or as needed for the particular symptom. So when I'm teaching acupressure protocol, I like to start at the top and then work our way down upper extremity, lower extremity. Typically, if it's a point where there are points on both sides, I start on one side, do acupressure, and then do acupressure on the other side. I tend not to hold both sides at once. It's hard to get even pressure when you're pressing 2 points at the same time. So 1 point at a time, side to side, top to bottom, is what we do. So next slide is the protocol for today. Let's see if it'll, okay. So while we're going through these points, hot flashes, night sweats, and Chinese medicine are all about things going up when they should be grounding and anchoring down. So while we're doing these points, I want you to think about whatever part of your body, like for me is my seat bones, because I'm on the floor, but whatever part of your body is touching the ground with these points, visualize connecting the point to the ground and sending your energy down. Very similar to when we were doing the nausea protocol. Okay, so you've done this point before. Do 20. It's right on the top of the head. So a ponytail. It's like right where, if you were doing a high ponytail, right on the top of the head, point in the center. Usually it's a little bit tender, and it's okay if you're a little off center. You're looking for like a little indentation, and you can pick one hand and then hold. And for each of these points, I try to hold the point for a couple of minutes, 1 to 2 minutes. And as I'm up here, I realize I don't have a method of time. If the amount that you're pressing is giving you any sort of headache, lighten up on the pressure. And I would also say switch hands with this point as you need to. Do 20 is one of those points that the channel starts right at your tailbone and then comes up the spine and ends here. It's a really good point to just visualize all the energy coming down to the bottom of your body. The next point we transition to is Yin Tong, which is another point that we have done. This is not the right protocol. Hold on. Here we go. Okay. Yin Tong. And that point, which we've used in almost every week, is directly between the eyebrows, center. I'm going to press with my right hand. This is another one that gentle pressure is good. Sometimes you feel it move a little bit towards the back of the head. But it moves the energy down more the front of your body. Do 20 is down your spine. Yin Tong is down the front of the body. You could also use your thumb if you need to, or a pencil eraser. Usually I press this one until I feel my forehead leaning back into my finger or thumb, and I get a couple of little pops, clicks in my neck. The next point that I'd like to do is large intestine 11, which I believe we did this point last week. It's right on the elbow, so halfway between, right where the elbow crease is, finding that, and then you're going right into this squishy part. It's halfway between the elbow bone and that crease. Just nice, even pressure on that. You can also rest your hand down if that's more comfortable. Switch to the next side. So same thing, finding your elbow crease, bone here, and you're going right in between. Sometimes there's a spot that has a little bit of tenderness, and that's a good one to go for. You want to make sure you're not too far forward onto the forearm. Right there. The next one I'm going to go down to is heart 7. So on the picture, hand is this way, and you're coming up. There's a little nook and a tendon right there. I also find it, let's see, right there. You can see where the bone is here and there. I'm going to start on the other side. So same thing, you're coming up, right in there. Okay, you're just holding pressure for a couple minutes. This one is the heart channel. And I like it because it also comes up into here, roots right in the armpit. So it's also helpful for patients that have cording or tightness in the underarm. It's also really good for that. And then this would also be a good one to use a pencil with an eraser if that's easier. I'm going to switch sides. So same thing. It's on inside of the hand, right here. It's right at the wrist crease, I should also say, if you're having trouble finding it. So just like the elbow was here, the wrist crease is right here. And you're going right on the outside of that wrist crease. Next point is going to be down on the ankle. Do this side first. So spleen 6, and we've done this one before. Coming right to the ankle bone here. We're going 3 fingers up from the ankle bone, and we're going right over the bone that comes up here. Your tibia comes up here. You're going right on the edge of it. 3 finger breaths up from the ankle bone. So ankle bone up. It's usually tender. If you have lymphedema, which is common, especially with how warm it is out, just be careful not to press too hard. You don't want to press enough so that you maintain a divot in the tissue. And if you have peripheral neuropathy, you might notice that there's a little bit of tingliness that comes down. Sorry, you can't see. It comes down the channel here. That's normal, but it shouldn't be too uncomfortable. I'll hold it like that, I think. You also could move it here. I'm using my thumb, but you could also use a pencil with an eraser. Okay, I'm going to switch sides. So same thing on this side. There we go. Ankle bone, 3 up, and then you're coming right in here. And I'm using my thumb. This one you might also feel a little bit going up the leg as well. Now, last point on both sides. So I haven't done any points on the ear yet. This point is right up on the ear. I don't think I'm not gonna be able to get close enough, but you're feeling all the way at the top of your ear on the inside. And there's like a little ridge that you roll up over. And I want you to pinch that ridge. So you're putting your finger, my thumb is right over that, and then I'm balancing it with my finger on the other side. And just like with week 1, where I can provide a better follow-up picture maybe, or a different angle. But this one, it's called Ear Shen Men. It's a very relaxing point. It also has a tendency to send everything down. It's also one we use something called ear seeds all the time for acupressure. It's like a little ball with a sticker on it. And then patients leave it in until I see them again. Over. You can see in there. Go like right in there. Okay. And I'm going to switch sides. Same thing, you're finding that little nook. You're pressing on it. If you need to change hands, you can change hands. I do have some people that, so as we're going through these, I know I said top to bottom extremities and legs, and obviously we're ending on an ear. It's up to you. You can practice whichever one feels more comfortable. I find doing ears at the end, or typically if I'm giving this as a prescribed homework for a patient, I'm using ear seeds on the ears already. So they're just following 1, 2, 3, and then spleen 6, but see what works for you. Doing it at the end, doing it at the beginning. If you're doing it at the beginning, you would be doing do 20, yin tong, ears, LI 11, heart 7, spleen 6. Okay? It was a little shorter protocol than other weeks. Any questions? Or thoughts? Okay. I think next week is our last week together. I think we might do something related to joint pain. If there's something else that you're interested in, feel free to put it in the chat. And I will see everyone next week.